This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program. I'm Dave Wilson. Our guest this morning is Dr. Peter Kochupura, pulmonologist at Mon Health. Doctor, good morning. Thanks for joining us.
Good morning, Dave. I'm happy to be here.
Did I get the last name close?
Yes, that's perfect, Kochupura. You nailed it.
All right. Well, I'm glad that you're able to take a few minutes with us. Obviously, we'll be talking about pulmonology this morning, but as we always do with all of our guests, you must talk about yourself at least for a minute or two here on the program. So tell us a little bit about yourself, where you're from, where'd you go to school, and what led you to practice with Mon Health.
Sure. So I grew up in New York City. I was born in India. My mom was a nurse. She went to nursing school in India, and my dad was in the Indian Air Force, and he wanted to come to the United States. And there was a nursing shortage in the U.S., and my mom was finishing nursing school. So my dad basically figured out, if you married a nurse, you could come to the United States. He kind of pitched the idea to my grandmother, and my grandmother said, wow, that sounds like a reasonable plan. So my dad married a nurse, and they came to the United States together. And that's how I found myself in New York. I went to high school in Manhattan at Regis High School. I went to the City College of New York for undergrad, and then I went to New York Medical College for med school. And I spent 4 years at Stony Brook University for residency and chief residency. And I came to Pittsburgh for a pulmonary critical care fellowship. I thought I would leave after 3 years, and that was 20 years ago. So that's that was kind of my path through medicine. I trained in pulmonary critical care medicine, and I found myself at Mon just because I've always practiced community-based medicine, and I thought this was an excellent opportunity to expand on that.
Well, just to warn you, West Virginia has a way. Once we get a hold of you, we don't let you go very easily. So I'm just warning you now.
That's what I hear. It is a beautiful state. I've spent a fair amount of time in West Virginia in the last few weeks, and boy, it is just absolutely gorgeous. I've really enjoyed it.
So what was it about Mon Health that interested you or you found attractive after spending time, coming from New York City, working in Pittsburgh for as long as you did? What was attractive about Mon Health?
Well, I've always practiced community-based pulmonary and critical care, which has been a blessing for me. I kind of lucked into it. I thought I'd be in a university setting, but fate kind of took me in a different direction. And I really appreciate the focus that Mon Health takes on community-based care. Mon is outstanding in that regard. It's not focused on NIH-funded research or training new graduates. We need those avenues in healthcare, but to some extent, the community mission and the academic mission really can't be accomplished easily together. And I've had the good fortune of working in some excellent community-based settings, and I recognize that here at Mon. I really genuinely believe that Mon Health provides excellent community-based care, and I've been doing this long enough now to recognize really high-quality leadership, and there is outstanding leadership at Mon. And so I'm happy to be here and contribute to growing the pulmonary service line in that regard.
Are you practicing here in Morgantown or other locations?
So I'm practicing in Morgantown, Preston, and Kingwood. Really getting a good sense of northern West Virginia.
And what types of pulmonary services are offered through Mon Health?
So we're going to provide a lot of general pulmonary medicine, which is really what the community needs. So that would involve caring for patients with shortness of breath, patients with asthma, COPD. We'll also provide care for patients with sleep disorder breathing, which typically consists of sleep apnea. And the other thing that's kind of unique is that I'm bringing a lot of expertise in advanced bronchoscopy. which involves robotic bronchoscopy and a bronchial ultrasound. And the goal there is for early diagnosis and treatment of lung cancer. This is a focus that I've had in the earlier parts of my career, and I'm very, very excited to bring that to the community here in West Virginia.
Talking with Dr. Peter Kochupura, a pulmonologist with Mon Health. We've got to take our first break. We'll continue the conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Peter Kochupura, pulmonologist, joining us here on Mon Health Talk this morning. And Doctor, what led you to pulmonology, to specialize in pulmonology?
Oh, that's a great question, David. I think that for most folks that end up working in pulmonary medicine, the pathway begins through the ICU. I love the ICU from early in internship. There's nothing quite like being in the ICU. I just didn't notice time passing. 1 week in the ICU as a doc has enough experiences to really fill a lifetime. And I've always enjoyed its challenges. It's a great team to work with. Working with the nurses and respiratory therapists in the ICU, really such an enriching experience. A lot of places train pulmonary with critical care, ICU medicine, and so pulmonary training was a package deal, and I wasn't really excited about it early in my career because it was the ICU that really excited me. But I came to appreciate the subtlety of pulmonary medicine and its nuance, and I spent a lot of time in the office caring for outpatients. And that was such a rewarding experience because you see a patient in the ICU and then you follow them in the office. And so you see them when they're really sick, and then you care for them as they recover. And that really made me a well-rounded physician and really just gave me such a broad perspective on healthcare. So that was kind of my path towards pulmonary medicine.
So what types of patients do you typically see and treat?
So a lot of the focus in my early part of my career was on sleep medicine. I always did a lot of general pulmonary, so patients with asthma, patients with COPD, and I had a little bit of an emphasis on sleep disorder breathing, diagnosing sleep apnea, helping patients transition onto a CPAP machine, and sort of managing that part of care. A little later in my career, I shifted towards lung cancer screening and robotic bronchoscopy. And the real change came in 2015 when Medicare approved lung cancer screening, which was a game changer for healthcare in the United States, because before 2015, there really wasn't a way to detect lung cancer early. And since 2015, we've had this tool of an annual CAT scan to find early lung disease. And so I became really immersed in that. And that's kind of where a lot of my focus has been since, for the last 8 or 9 years now.
Well, let's get into that a little bit. When it comes to lung cancer screenings, what is the latest and greatest, I guess, that is available to patients to detect these, especially early on?
Well, so lung cancer screening really began in 2015. And I was working at UPMC at the time, and I was very deeply immersed in this process early. When you have a new screening program, the question is, how do you introduce this to the community? How do you educate the community? How do you, as a healthcare provider and as a healthcare system, roll that out in a way that makes sense? So I worked at a community hospital, and we started a lung cancer screening program at that hospital. And I led that program, and it pulled me into organizing it at a system level for UPMC. So I was a part of the steering committee for UPMC and lung cancer screening. So locally at my hospital, we performed over 4,000 studies during my period of involvement. At the system level at UPMC, we performed over 25,000 studies. And it was fascinating to be a part of that, figuring out the nuts and bolts of introducing a screening program to the community, driving the elements that lead to its success, improving awareness, educating primary care docs. And so it was really amazing being a part of that at a local level and at a broader level.
We're talking to Dr. Peter Kochupura, pulmonologist with Mon Health. We'll take our final break, and we will continue our conversation on the other side. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health System and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Peter Kochupura, pulmonologist, joining us this morning here on Mon Health Talk. And Doctor, is West Virginia a bit unique when it comes to practicing pulmonary medicine?
Absolutely. West Virginia is truly unique. West Virginia has some of the highest rates of cardiopulmonary disease and obesity in the country. There's coal mining, there's occupational lung injury, there's higher rates of interstitial lung disease, particularly in smoking exposure. Some of that work was done by Dr. Ghulam Abbas, it's thoracic surgery at Mon Health. And there's also higher rates of unrecognized sleep disorder breathing. The literature shows that the formal diagnosis rate is around 9%, but it's probably closer to 25% in the community based on estimates. So there's this gap between the formal rate of recognized sleep apnea and what's likely to be the true rate. And so that's a big population of patients who just aren't being recognized as having a disease. And the reason for this is because there are parts of West Virginia that are traditionally underserved. The rural areas where there's limited access to care make it challenging to diagnose obstructive sleep apnea. But moreover, cancer screening and cancer treatment is more difficult in these areas where there's a lack of resources. There are resources that we take for granted in cities that routinely saves lives that are scarce in rural areas. And so even simple things, preventable things, are hard to accomplish when resources are scarce. So the goal is to improve provider confidence and improve patient confidence by improving access to care. We want to improve provider confidence in diagnosing and treating sleep apnea. We want to improve patient confidence in tobacco cessation. We want to improve lung cancer screening so that we can find lung cancer early rather than during its late stage. And a lot of that begins with awareness across West Virginia, but we also need to find better pathways to connect patients and doctors. It's amazing when you talk about robotic bronchoscopy. There's so much technology in 2024. If you describe robotic bronchoscopy to me in medical school, I just wouldn't have believed you because it sounds like science fiction. We have so much knowledge compared to 20 years ago when I first began practicing. But to apply that knowledge and to use these incredible tools, we need better pathways to connect patients and providers across West Virginia.
Sometimes it's all about asking the right questions. So when we visit our primary care physician, primary care provider for an annual checkup, what kind of questions should we ask when it comes to pulmonary medicine?
I think first and foremost it begins with tobacco cessation, either for yourself or for a loved one. There is so much value in tobacco cessation in the short and long term in terms of improving respiratory symptoms, improving quality of life, improving the ability to perform the routine activities that we take for granted. If not for yourself, then for someone that you care about. The other important thing that I would encourage you to ask about is sleep apnea screening. Again, either for yourself or someone you care about, because we can do so much to improve quality of life and to improve outcomes if we can do a better job of diagnosing and treating sleep apnea. And then a topic that's very dear to my heart, lung cancer screening. If you have a history of tobacco use or you have a loved one who has a long-standing history of tobacco use, definitely ask about lung cancer screening because it's the most effective tool outside of tobacco cessation to prolong life and to improve life in patients who've smoked. And if you have a question about whether your respiratory symptoms are because of a treatable condition, a lot of the times we will use pulmonary function testing to tease that out. And so definitely ask your healthcare provider whether there's a role for pulmonary function testing.
Got about a minute. How can patients get in contact with you? Would this be through a referral from our primary care physician, or can we reach out to your office directly to make an appointment for any of the services we've talked about?
Absolutely. You can find me through monhealth.com, and a referral through your primary care doc would do it as well.
Like you said, monhealth.com. You can always go there to get more information on today's topic or any of the topics we cover here on Mon Health. Dr. Peter Kochupura, pulmonologist, appreciate you coming on, taking some time. And again, I will warn you, West Virginia has a way of grabbing a hold of you and never letting go again. So we're happy to have you.
Thank you. I look forward to that. Thank you, Dave.
Absolutely. Dr. Peter Kochupura, pulmonologist. And again, you can get more information over at the website. Go to monhealth.com.